Hello, good afternoon. Another topic for today is the personal hygiene. Okay, so this is a personal hygiene of an elderly. Now remember that we have two types of patient, the dependent and independent. When you say dependent, they are 100% depending on the nurse or on the healthcare provider. It means that they cannot do the task because of some health issues or because of their health condition, like when the patient is paralyzed, the patient is body weakness, the patient is unconscious. So you will be the one to provide all the care for the patient. Now, for oral care, you have to use antiseptic oral solution. You have to use suction machine. You have to use your tongue depressor and also your foam swab. Okay. For conscious patients, and we call that independent patients. So the second type of patient is independent patient. Independent patient means they can do the task with the assistance of a healthcare provider, or they can participate on the task. Like, for example, patients can move, can get up, and for patients who are conscious, they cannot only get out from the bed or walk from bed to the toilet because of some restrictions. One restriction is when you are pregnant and you are having some bleeding issues, then you are not allowed to move. Okay, you are not allowed to go to the toilet, and we call that patients is placed on CBR or complete bed rest. And example of patient is when patient is having heart problems, or patient is recovering from major surgeries. They are not yet allowed to walk, so you have to provide personal hygiene on the bed. Now, first is oral care. Okay, you have to give oral care to your patient, and this is scientific care of the teeth and mouth. What are the purpose of oral care? To keep the mucosa clean, soft, moist, and intact. To keep the lips clean, soft, moist, and intact. To prevent from oral infections. To prevent from halitosis or bad smell or bad odor from the mouth. It also freshens our mouth. It removes food from our mouth and prevent dental plaque without damaging the gums. And it alleviates pain and it promotes comfort or enhance oral intake as well. So we offer or provide oral care for patients, and one of the purpose is to enhance oral intake or enhance their appetite. Now, what are the equipments required when providing oral care? We need a tray, and we place the equipment on the tray, like a gauze padded tongue depressor. We have the foam swabs, okay, and some gauze padded depressor. But see, if your patient is independent, she can participate on the task. She can use toothbrush, she can use toothpaste, and also water. Okay, but for dependent patients, remember, you can only use this antiseptic oral solution, foam swabs, tongue depressor to suppress the tongue. You must also use kidney basin and also your suction machine. Now, after cleaning the mouth and tongue of your patient, then go to shampoo. Okay, place the patient at the edge of the bed, and you must remove the pillow, and you have to place the incontinent pad, or we call the padding, okay, of the patient to protect the mattress. And you have to form a funnel to place at the neck of the patient so that the water will drain directly to the pail. And the patient this time is in supine position. So you have to adjust the head part of the bed. But when you are providing oral care, the position of your patient is in semi-Fowler's position. The head part of the bed is inclined to 30 degrees. Okay. Now, first, you have to brush the hair before you wet the hair of your patient. So brushing the hair of your patient, especially for female clients, remove hair tangles because it's very hard to clean the hair with those tangled hair. So you have to brush first the hair, then after that you have to wet the hair, apply shampoo and rinse. Now, if your patient are requested for hair conditioner, then you can also apply hair conditioner. But before you wet the hair again, you must place cotton balls both of the ears to prevent the water to go inside the ear, and you have to close the eyes so that the water won't go inside the eyes. But before doing that, always ask permission from your patient. Okay, patient must know what are the steps that you have to do, okay, to perform personal hygiene. So it means that when you are doing your personal hygiene, like bathing and grooming, you have to explain to the patient so that patient will participate or cooperate or comply with the task. Okay, next is you have to dry the hair or wrap the hair for female. Okay, then remove the underpad or the incontinent pad, remove the towels, the cotton balls, the face towel used to cover the eyes, and return the pillow. Now this time we have to wash the face, okay? Start from the face, but we have to start first with eyes, okay? Make a mitt, and you have to prepare 2 basins. And those 2 basins contain with warm water. Okay, test it with the back of your palm or the elbow because this part are sensitive when it comes to temperature. Now, if you have water thermostat, you can use as well the water thermostat. Then test with the back of your hand and elbow, or if your patient is conscious or awake, and let the patient test the water, okay? Then you have to make a mitt. Wrap the towel, make a mitt to your finger, then try to clean the patient's eyes from inner to outer canthus, making one direction using one end of the mitt or one corner of the mitt. Next, the next corner of the mitt, you have to clean the other side of your eye, the next eye. Okay, so that when you have infection in this eye will not be contaminated with the infection because you are using different end or corner of the mitt. The next is your face. Okay, so the process of bathing is first you have to wash, rinse, and dry. Okay, so in our face, you have to start, make a mitt again. Start from the forehead to the cheek, chin, neck, back of the ears. Okay, so that is how you clean the face. And after cleaning this side of the face, then do again the same direction and process to the other face. Now, for cleaning the face, you have to ask the patient if they have their own soap on the face. But basically, we don't apply soap on the face of our patient. But if patient will request to use their own soap, then we can use it. Okay? Then after that, we go to the arms. Now, before going to the arms, we have to undress our patient. Always provide privacy. Okay, cover the patient's body with a towel, and the towel should be the big towel. Okay, then you can slowly remove the gown of the patient. Okay, pull it downwards so that you are maintaining privacy to your patient. Now let us start from the arms. So remember again that when the bed is against the wall, you have to start from the far eye, far arm, far leg. Okay, but when you can go to the other side of the bed, you can start with the near eye, near arm, near leg. Okay, let's say the bed is against the wall. So I have to start from the far arm. Place a towel under the arm so that the mattress will be protected, okay, from water. Again, start from wrist to elbow, elbow to shoulder, axilla, and hand. I'll be sending you also the video and how to do properly the steps in bed bathing. Okay. Now, you have to cover all surface of the skin. And when you are washing the arm, you have to start from down going up in one direction. Okay? And the last is the hands. You have to wash it directly on the water. Okay? Then pat and dry. So again, wash, rinse, and dry. So the same thing that you will do on the other arm. Now, we're done with the left and the right arm, so let's go to the chest and abdomen. Again, maintain privacy. So in the abdomen, make a mitt, then you have to do zigzag. Okay, when you are cleaning the chest and abdomen. Then after washing, you have to rinse, then pat and dry with the towel. Now, you will now start from waist down because we're done with the upper extremity. Let's go to the lower extremity. Now, when you will start from waist down, you have to change water, change gloves, and change towels. Let us do first one leg. Uncover the one leg and place towel under the leg to protect the mattress from water. Now we have to start from the foot joint to the knee, knee to the thigh, and foot. So the same direction when you did it with the arms. So it should be upward process, okay, or upward direction, okay, just in one direction. So you have to cover all areas of the leg, from foot joint to the knee, knee to the thigh, and foot. In your foot, the same as you did with the hand, you have to clean it on the basin with water. Okay, so after washing, you have to rinse and pat it dry. So this time you have to clean the perineum. Place an Inco pad under the perineum. Yeah, patients, they love to clean their perineal area with water, okay? But let's say when you are changing diapers, you must clean first the perineum before you put a new diaper. Okay, you can make 4 folds of your towel. Then cleaning the perineum, there is also the proper way of cleaning from front to back. Okay, in one direction, front to back. You have to fold the towel, spray with antiseptic solution. This antiseptic solution, it depends upon the hospital policy, okay? Then the other labia, you have to fold, then the other labia, okay? Until the 4 folds is already used and the last is at the center. Now, my point here is when you are cleaning the perineum, you have to start from front to back. This is to prevent infection. Because see, when you start from back to front, our anus is at the back, and you are introducing microorganism to the urethra. The microorganism or the bacteria can enter the urethra and it can travel going to our bladder, to our ureters, and to our kidneys, and we will have urinary tract infection. So preventing that infection, we have to follow the proper way of cleaning the patient's perineum. Okay, perineum, remember, from front to back. When you are cleaning the buttocks, it's the opposite, back to front. Now, after cleaning the perineum, turn your patient to the, let's say, left side, okay? Now, you have to place a towel at the back because we have to clean the back and buttocks of your patient. Now, the same direction you did in cleaning the chest and abdomen, you have to apply it on your patient's back. So you have to do the long zigzag direction at the back. So wash, rinse, and dry with the towel placed at the back of your patient. Now, going to your buttocks again, it's the opposite. You have to start from back to front, making 4 folds of your towel. Then after that, don't let your patient roll back to the other side. Let your patient remain in a side lying position. Roll the patient, loosen the linens, then you have to roll it towards the back of your patient. Now, the right part of the bed is now vacant. Okay, so there is no linen. This is the time you have to clean the mattress. Cleaning the mattress, you have to start from head to the center towards the foot. Okay, again, one direction. You have to make 2 washcloth. One is wet and one is dry. So again, there will be an official antiseptic solution that we're going to use in cleaning our mattress. Okay, then after the wet washcloth, you have to dry it. Now, once our mattress is dry, this time we can spread our bottom sheet. Okay, spread our bottom sheet, then make a mitered corner. After the bottom sheet, you have to place your rubber sheet, and rubber sheet should be placed at the center of the mattress. On top of your rubber sheet, you have to place your draw sheet. Your draw sheet is used to protect your rubber sheet, and this is also used as lifter or slider. Okay, when you lift your patient up, you don't have to lift your patient on the body. Okay, you have to lift it with the draw sheet. Okay, so we use this as a lifter. Then after your draw sheet, we have to place the EncoPad and also our diaper, okay, adult diaper. And while your patient is in the side lying position, you have to place one sleeve of a new gown, okay? And after that, Adjust the pillow and roll your patient towards the right. Okay, remember, when you are turning your patient, don't forget to raise the side rails. If you forget to raise the side rails, your patient will fall. Okay, so preventing injury and promoting patient safety, don't forget to raise the side rails. Now, don't bath alone. You must bath together with somebody. Okay, now go to the left side and remove the soiled linens. Now, we have soiled linens and contaminated linens, and we have the underpad and the diaper. So make sure that you are placing those linens in their proper places, and we call this segregation of your linens. Now, when it is soiled linens, it means it's only dirty, no discharges. Place it on the hamper. Okay, remember that. But linens with discharges like water, urine, blood, stool, or any body discharges, place it in a yellow bag and you have to seal. Okay, because that is considered contaminated. Now, how about your diapers and IncoPad? You have to place it directly in a yellow bin. Now, never place your linens, dirty linens or contaminated linens on the floor or on the table. You have to place them directly on their proper bins. Now, the same thing that you have to do it on the right side, you have to clean the mattress. Okay, from up to the center to the bottom. Okay, then dry it. Then after that, you have to pull the new linens, spread them all together, make a miter corner and tuck them under the mattress. This time you have to change the pillowcase. Okay, for your pillowcase, the opening side should be always facing the wall, not facing the door. Okay, then after you change the pillowcase, cover your patient with the top sheet and the blanket. Okay, you have to tuck it at the foot part and make a mitered corner, but only the half, a part of the top sheet and blanket. So after that, raise the side rails, return the co-lights, and you have to ask feedback from patient, especially patients that are conscious. Asking feedback can improve your nursing care, your care provided to them, and you will know how the patient feel, okay, after providing bath. Okay, don't forget to ask feedback from patient. As long patient can talk or they are conscious or awake. Then you have to return all the things you need. Then you have to remove first your apron. When you are doing personal hygiene, remember to wear apron, wash your hands, and wear your gloves. So after you've done care to your patient, you have to first remove your apron, then remove your gloves, then do hand washing and document the care.